Hi, and welcome to another episode of the Lifelight Therapy Podcast. Today, we're going to talk about lifelight versus scarring. So, when I talk about scars, I'm talking about anything from like old acne scars to surgical scars, internal scars from past surgeries that might be 20 years old. And amazingly, Lifelight Therapy can help address any of those. So the same sort of mechanisms that work on all the other cells are the same ones that play with scar tissue. The light can help energize cells to do what they're supposed to do better and more efficiently, uh, basically feeding energy into them, reducing the inflammation, which can help reduce the appearance of scars, and then really just digging down and increasing the circulation, getting stuff cleared out, and helping your body clear out old scar tissue, um, and even some really dramatic, um, in some really dramatic ways. For example, we had a patient who had probably 4 or 5 knee surgeries over the course of 20 years, and they came to us, and there was just so much old scar tissue built up in her knee that it was continuing to cause problems, and that she couldn't really get healing, and it was just getting worse and worse. And so she started putting the Lifelight pads on her knee and running the scar tissue protocol. And over time, sure enough, it started, removing. Her body was able to remove the scar tissue and bring healing to that area, and saw incredible improvement. So, even if it's old, stubborn scars, it's worth going after with Lifelight therapy. Old scars are not something there's some things you can treat with light therapy, and you'll see results after the first treatment. Scars are kind of like neuropathy, where they take a bit more time. Another thing, where overlap with neuropathy and scarring. A lot of time with scarring, you have some loss of feeling. Also, nerves have been damaged in there, and like the neuropathy protocol, the Lifelight can help kind of regrow those nerve endings, so you can even get feeling back. So if you have a Lifelight therapy unit, the protocol to use for scarring is number 19, scarring. So that one's pretty self-explanatory. And you just put it on there. I mean, if you have time to do a 30-minute protocol, then do it 30 minutes. And you can just do 30 minutes once a day, or every other day. And less than that if you really can't get to it. But if you want to get rid of stubborn scars, I'd do like 30 minutes every other day at least. And you should see significant results within a few weeks. So, as always, if you have any questions about this protocol or any other issues that you're wondering if Lifelight Therapy might be able to help with, reach out to us. Go to our website, lifelightTherapy.com, and we'd be happy to help. Thank you.